Hello, welcome to Grand Rounds. Please keep in mind, as usual, that the Grand Rounds are being teleconferenced, so don't walk in front of the screen. And if you're 8 or 9 feet tall, don't walk in front of the camera. Please turn your pagers and your cell phones to vibrate. As usual, that's my reminder. And if you're sitting at the end of a row, please move into the center to allow others to come in and sit down more easily. Please try to keep ambient noise in the room to a minimum. We don't serve food anymore, so my biggest worry is that somebody will bring in a bowl of Captain Crunch. Please remember to discard your trash in the bins located at each exit at the end of rounds. And today we're very pleased to have one of our residents, Jennifer Luz, talking. She is currently a PGY3 resident at the Spaulding Rehabilitation Hospital, Harvard Medical School Physical Medicine and Rehabilitation Residency Program. She graduated from Tufts University and Tufts University School of Medicine in 2011. Her clinical and research interests include musculoskeletal and sports medicine, as well as medical student and resident education and mentorship. And she has an interesting presentation, unusual one, on athletes on the job, the benefits of exercise for first responders.
Thanks, Dr. Glenn. Hi, everybody. Thanks for coming. Welcome. So today I'm going to talk about athletes on the job, the benefits of first responders. And when I say first responders today, I mean police and fire. So I have no disclosures or conflict of interest to tell you about. Objectives of the talk today, I'm going to speak about the epidemiology of injuries and illnesses specific to first responders. We're going to go through a brief literature review. There was way too much data to put in here, so I tried to touch on the most important studies. What's being done currently to support first responder health and methods you can employ to reduce the risk of injury to first responders in your practice. So I'll tell you the way I became interested in this topic. First of all, it is personal. Both of my grandfathers were in service to their country. One of them fought in World War II, and actually a lot of this research started with military folks. And my other grandfather was chief of police in Peabody, and in the line of duty he had an amputation at the hip to his leg, and he continued to work despite that amputation. Also, I was at the marathon last year, and I did a fundraiser for it afterwards. And through that venue, I met a lot of police and fire. And when I talked to them about this issue and I did my own research, it came up that they're definitely an underserved population and that there's a lot that we can do to help them further. So let me start off by telling you a story to illustrate what an important public health issue this is becoming. This is a New York Post article from just last year, not long ago. So the FDNYs, it's a very competitive force to get onto, actually. And in previous years, there was an entrance exam, a written entrance exam, that I hear even the security guards out here tell me it's actually very, very difficult. And the second part of it was a physical examination test to get them on the force. Last year, a judge in New York decided, okay, we need more diversity on the force in terms of minorities and women. So he dropped the physical part of the test and just stuck with the written. Then there was a huge washout of recruits early on in training because they just could not keep up with the training. It was just way too difficult. And the New York Post got wind of this, and it became a very public issue in New York. So nationally, at any one point in time, there's approximately 1.5 million firefighters at work and over 800,000 law enforcement officers, huge numbers. Firefighters and law enforcement have 2 to 3 times greater injury rates treated in emergency departments nationally than the U.S. labor force in general. The numbers are staggering, the numbers of injuries that occur to these folks. So the epidemiology of firefighter injury, approximately 100 line of duty deaths annually. And direct fire injury, interestingly, is not the most likely cause. Can anyone guess at what the most likely cause is of line of duty death for these guys? Yeah, cardiovascular. So nearly 50% of these line of duty deaths are actually cardiac related, and most of them are heart attacks. Usually, just an interesting fact, it's with setting up water supply operations, as that's the first physically strenuous activity a firefighter has to do on the scene. 3 out of 4 of them are unexpected. And there's a 17-to-1 non-fatal to fatal ratio. So for example, in 2012, we have the statistics, 81 firefighters died in the line of duty. 45 of those 81 were categorized as stress or overexertion. And 39 of them, when they took a look on autopsy, were an acute coronary event. 3 of them were a CVA, 2 were due to heat exhaustion, and 1 was an aneurysm. 90% of them actually were over 45 years of age. This slide's interesting. So occupational injury retirement, 27% of all firefighter retirement is due to an occupational injury or illness. And an MSK injury is twice as common as an illness retirement, such as heart, lung disease, or cancer. And 1/3 of those are due to a back injury, something that we might be able to help out with. I'll discuss that in a little bit. So epidemiology of law enforcement injury is actually very similar. So the number 1 cause is assaults and violence. That's not surprising, but a very close number 2 is physical stress and overexertion, which includes cardiac issues. So from 2000 to 2010, the National Law Enforcement Officers Memorial Fund found that 7% of occupational deaths for law enforcement were actually due to an MI. And in 2010, the occupational mortality rate for law enforcement officers was 18 per 100,000 workers versus the national average of 3.5. So, I mean, whoa, that's a 6 times higher rate of death for law enforcement officers on the job. So severity of police lost work time from injury. Let me go back and say, to remind you, 90% of duty-related fatalities are due to an assault or a vehicle accident. So we know that, and that's something we physicians unfortunately can't help very much with, but injuries are a different story. Assault turns out to be 27%, and physical stress or overexertion is very close at 25% of causes. And interestingly, injury from physical stress or overexertion usually results in 5 days off from work, which is more time off from work versus an assault, which usually they take about 4 days off from work. So interesting that the severity is also higher. So moving on from, we just talked about the basic epidemiology where we learned the occupational risk of death or injury is much higher in firefighters and law enforcement than the average US working population. So now we're going to go on to discuss injuries and illnesses specific to police and firefighters with a brief review of the literature. I couldn't fit in half the stuff that I wanted to in this part, so I'm just going to touch on the most important. So discussing cardiovascular disease in first responders. Dr. Stefanos Kales, who's one of my mentors for this project, he's at the Harvard School of Public Health. This is a landmark study that he did in New England Journal of Medicine in 2007. He found over 1,100 total deaths in the line of duty for firefighters in that study period, and 40% were attributed to a cardiac event. He found something interesting. He called it the rule of thirds in this paper. So 1/3 of those deaths occurred during fire suppression, which I thought would be the majority. But the other 1/3 are to and from the fire, and the other 1/3 is during training, actually. This is another study by Dr. Kales a little bit earlier. He again found that the risk is very high with fire suppression, and that if an autopsy done, which is not always the case due to unfortunate monetary issues, that it's not always the case, but if one is done, coronary heart disease is likely, or left ventricular hypertrophy that was not known while these guys were living. And only 1/4 of them were assessed medically in the past 24 months before the assessment. Zimmerman is a cardiologist who did a review of cardiovascular risk factors in law enforcement. And he found, not surprisingly, that law enforcement officers have all the same traditional risk factors as the rest of the population, but just to a greater degree, a much greater degree. So Tiriades, same thing, found the same traditional risk factors in firefighters. A couple interesting things, though, I wanted to point out. Again, the prevalence of obesity, but also something he called the firehouse diet. These guys in the firehouse, they eat a lot of fast food. It's kind of a locker room atmosphere, and they all eat very quickly because they're not sure when the next alarm is going to go off. They also have a family tradition, he found. So the grandfather, the father, the son, they're all going to go into firefighting, and they're usually from the same town, go into the same department. So he found actual genetic trends in cardiovascular disease in each department, interestingly. So now we're coming to a unique intersection in the talk. So these guys have the traditional risk factors and underlying disease for cardiovascular disease, but they also have several factors that are unique to first responders. So back to the Zimmerman article regarding law enforcement officers. They do have a few occupation-specific risk factors that he found. The first one is sudden physical stress. Sedentary activities are suddenly interrupted by these extremes of intense physical exertion. That can cause life-threatening cardiovascular complications. As we know, it's been established in the general population that the relative risk of an acute MI is 2 to 10 times higher during a stressful physical event. And this episodic physical activity also puts you at risk for a lethal cardiac arrhythmia as well, or sudden cardiac death. That's on top of the fact patrol officers will be carrying an extra 20 pounds of equipment just on their duty belt, and their body armor can weigh an additional 7 to 8 pounds. The second factor that he found was psychological stress. So there aren't too many residents in the room, but I was going to try to set up this scenario. You're on MGH Neuro, and you're exhausted. You're not going to the gym. You're getting paged constantly, no sleep. But luckily, we have never felt like our lives have been in danger. Fair enough, right, Jenny? Fair enough to say. But these guys are doing the same thing, but they have to look over their back. They're concerned that their life is in danger, their partner's life is in danger, and they're trying to take care of whoever needs rescuing. The next factor he found was shift work. Just like physicians, again, we can relate to this one. There's a continuous service need for police and fire. And shift work and sleep disorders have been associated with CAD, MIs, lots of cardiovascular risk factors, especially metabolic syndrome. And the other risk factor that he found was noise exposure. Imagine yourself again on call, finally getting some sleep, and that pager goes off. Does anybody ever have a visceral response? You know, your heart rate might go up a little bit, your stomach might turn a little bit. These guys are constantly exposed to that over the years, and some studies have shown that with accumulation, these rises in heart rate and blood pressure are actually sustained throughout their life as opposed to just a transient response. So Tiriades for firefighters did the same thing. He found that they have unique risk factors for cardiovascular disease, including, in addition to law enforcement officers, also smoke inhalation and heat and dehydration are also a risk. So there are physiologic changes that occur in the body because of the nature of the job, unfortunately, and this creates the perfect milieu for a cardiac event in police and fire. I thought this was a really interesting study. This is Dr. Kales again. In 2011, he found first responders have increased cardiac demands on the job beyond that of most occupations. We've established that. An on-duty firefighter may be carrying 50 pounds of protective equipment, plus 20 to 40 pounds of tools, plus they climb ladders, advance heavy water hoses, they're dragging victims. It's a very, very difficult job, obviously. In fact, if anybody would like, I brought in some equipment from one of the guys that I've been talking to. If anybody wants to pass this around, if you want to come up, Matt, start passing it around. Some of them are heavy, just be careful. But you can put on the jacket, try it on, see what it feels like. I had no idea how heavy, in fact, the equipment is. It's really surprising. So Dr. Kales determined the most beneficial dimensions of physical activity for firefighters to safely perform their job. The consensus does not exist right now as to the minimum aerobic capacity required to perform it safely. Studies in the 90s measured it at 12 METs. And in this study, Dr. Kales found 75% of firefighters were reporting less than 150 minutes of aerobic exercise per week, which is a lot less than the minimum recommended by ACSM. And almost 40% of them were unable to achieve the 12 METs required to safely perform firefighting. So just to sum up this part, we've learned that the interaction of excess stressors on a susceptible pre-existing biologic substrate is what puts police and fire at such a risk for cardiovascular disease. Musculoskeletal injury is also prevalent in this group. And what are the injuries specific to first responders? We're going to go through that as well. This was the first prospective evaluation of obesity as an independent risk factor for injury in firefighters. And it was only published last year in 2013, but it was the first paper to take a look at this. And they did find that there is definite obesity status based on BMI and waist circumference were significant prospective predictors of MSK injury incidence. They didn't study the mechanisms in this paper, but they suggest that excess load on the musculoskeletal system leads to altered biomechanics and a higher risk of injury. This group studied the equipment that police officers are required to wear, whether it has a risk of injury to the musculoskeletal system. We already know obesity is a problem, but the equipment that these guys carry put them at a higher risk as well. So police use in-vehicle computing systems called mobile data terminals, and it does make them more productive via increased access to information and resources. However, low back pain prevalence has increased in professional drivers such as bus drivers, taxi drivers, and now we can put police in that category as well. So we think that flexion of the lumbar spine in a prolonged seated posture is perhaps a potential risk factor for low back pain. And nearly 6 hours of an urban officer's shift is spent in the car driving, and 40% of that time is spent using the mobile data terminals. So this study found significant increases in neck, shoulder, and mid-back and low back discomfort, which increased with typing versus just driving alone. And the low back area was of greatest subjective discomfort, not surprisingly. So I put the pandas in there to just show a comical illustration of how this has become an industry to find ease for low back pain while driving. This is another study that examined complications of the required equipment. So they examined the effects of on-body personal protective equipment and car seat design on pelvis and lumbar kinematics with police officers. So they measured seat contact pressure and perceived discomfort during simulated driving, and they did find that the protective vest and duty belt alters posture. Now in that top picture, that's the duty belt that they wear currently, and then they have a reduced duty belt underneath, and they found that with the reduced duty belt, there was less seat pan and backrest pressures than the full duty belt, which actually relieved a lot of their low back and pelvic discomfort. Dempsey's group investigated the effect of added load during intense exercise on jumping, landing, and ground reaction forces, especially where attentional demand was varied. So they found that the added load does impact jumping and landing performance, and the effect is amplified by prior intense exercise and distraction during landing, which is a scenario the police find themselves in all the time. So they advocated for specific strength training and training with appropriate landing techniques and a gradual exposure to carrying equipment to allow the body to adapt. So first responders that I've talked to so far are most interested in this aspect of occupational health, in psychological health and sleep disorders. This group studied the effects of lifetime exposure to shift work on health impairments and fitness for duty, and they found an increased risk of reduced fitness for duty with increasing years of shift work. especially even controlled for age, they still found the same effect. There's an exponential trend indicating a rapid increase in health impairments, especially after 20 years of shift work. And this group wanted to determine the prevalence and severity of excessive daytime sleepiness in a population of firefighters. They actually found the rates were very similar to the US population and to comparable occupational groups, which I was surprised by. But what they did find was the only health factor consistently associated with excessive daytime sleepiness in this study was depression. It was actually twice that of their peers. So we went through the first step. We talked about the numbers, and we know that there's a public health problem out there. And we know what types of injuries and illnesses affect this group. So now let's look at groups that have implemented an exercise intervention and the positive effects on cardiovascular, musculoskeletal, and psychological health. So Wolkow, this group last year did a systematic review to take a look at the literature already out there. They wanted to look at the evidence base regarding fitness interventions devised to mitigate cardiovascular risk factors in this group of first responders. They found 16 studies and 15 of them were weak, poor methodology. So basically, I wanted to start out this part by saying we don't know much, and unfortunately, better studies are needed. But here's one study that I found interesting by Abel's group. They wanted to compare circuit-based workouts to data reported on firefighters performing fireground and rescue tasks. It's basically CrossFit for firefighters. And they did find that tactical strength and conditioning has become more popular in the National Strength and Conditioning Association. They have a subgroup including firefighter strength and conditioning professionals, but there's a lack of scientific data out there to support what they do. So they actually did find in this study that there were similar degrees of stress, at least on the anaerobic system, comparable to the most demanding tasks on the fireground. And they suggested a circuit including deadlifts up there on the left, wood chop with a cable machine in the middle, climbing stairs with hose bundles, dragging a rescue mannequin down at the bottom left, and pulling a weighted sled with a hose down on the bottom right. Lindbergh's group did something similar. Direct measurements of VO2 max is complicated, time-consuming, expensive. It's less than optimal as a standard procedure to measure their aerobic capacity. So this group wanted to evaluate the correlation between direct laboratory, indirect field aerobic capacity tests, and commonly occurring and physically demanding firefighting tasks actually on the fireground. And they did find strong correlations between the direct and indirect tests and the commonly occurring physically demanding firefighting tasks that are part of the job. They actually did find that they correlated in every category except for demolition. This group evaluated the impact of a supervised 6-month job-specific minimal exercise program in sedentary law enforcement officers. So for the first 6 months where the law enforcement officers had paid time to work out, they all participated, all the parameters that they studied improved. Body weight went down, BMI went down, and their time on an obstacle course actually improved. After the 6 months, they weren't required to participate any longer. So they did a follow-up at 18 months, and no surprise, unfortunately, the effects did not last. But they did find that about half of them were still getting at least 150 minutes of exercise per week, and they regained less weight and didn't lose as much of their cardiovascular fitness as opposed to those that didn't continue the exercises. And Gerber did a study, what benefit does fitness have on mental health? And I think that we, as busy physicians, know that there's obviously a great effect on mental health. This study found that high cardiopulmonary fitness reduced cardiovascular risk markers and mortality, but it also protected against the development of depressive symptoms and reduced the symptoms of occupational burnout as well. So yes, now we know there is a benefit for fitness on cardiovascular, musculoskeletal, and psychological health of first responders. We know that there's a great effect. We can see the papers. They are out there. Especially, I'd say, over the past, it seems like 5 years, there's been a lot more literature coming out specific to police and fire, and I think it all started after 9/11, that the number of papers out there increased. So, but why should departments implement these programs? Everything always goes back to money. That has been a barrier for a lot of departments to implement anything. So can we prove that there's a cost benefit to implement fitness interventions in police and fire departments? Especially, just to mention one more thing, the Hometown Heroes Act that was put into law in 2003 gives a one-time sum to families of police or fire that have lost their family member due to a stroke or an MI within 24 hours of a strenuous on-duty event. So it's definitely a public health issue and a public health cost issue. So this group took a look at the FLAME program through the NIH. So the FLAME program, it's wonderful, actually. It's a peer-led health promotion program, sort of a train-the-trainer program, consisting of 12 45-minute sessions conducted by a firefighter at the fire station during a shift. So they focus on healthy eating, exercise, injury reduction, and stress management. And it's been well received and easily implemented, and some of the first studies taking a look at it were back from 2004. So in this study, they assessed firefighters' workers' compensation claims and medical costs for those that were in a FLAME program as opposed to departments that were not in a FLAME program. And they found that workers' compensation claims were significantly reduced after implementation of FLAME at that department. And although the average annual incurred medical costs increased in both groups, the FLAME departments only increased by 1% per year, whereas the non-FLAME groups increased by 5% per year. And they also had a positive return on investment of 4.6 versus controls. Steinhardt, this is back from 1991, but this is an interesting study that wanted to determine if the level of physical activity and cardiovascular fitness was related to absenteeism and medical care claims in law enforcement officers over a one-year period. So they wanted to answer the question, are moderate levels of physical activity and fitness inversely associated with absenteeism and medical care claims? So I have two tables from the study. Here's table one. The overall effect for activity level revealed that sedentary officers were absent significantly more than officers who were even occasionally active. And in this study, it was 3 times per week. They had reduced absenteeism found at even moderate levels of physical activity. In this table, that's displayed here. And then in the next table, we see that with medical care claims in cost per year, it's also reduced in the occasionally active or moderately active group as well. So we know there's a major public health problem out there leading to increased risks of death and injury and public health care costs as well due to this issue. And many of these first responders that I've been talking to actually feel very underappreciated, and unfortunately that the public has sort of a mixed view of them. Most of us only come into contact with them when we're in trouble. We get pulled over for a ticket or whatnot, and so that's what they think our view of them is. And one guy, I'm rotating right now with Jim Andriutakis in Medford, and we had a firefighter come in and he had low back pain. And I was telling him about this talk, and he said, and we all bottle this up. We don't talk about it. We don't discuss it with each other, and we don't talk about it because we don't want the rest of the department to view us as weak or we can't do our job. He said, nobody wants to be next to their partner who has a low back strain because he says, he's not at his peak. I don't know, are we going to be in trouble if he's out there in the field and not performing at 100%? So I think that this is an opportunity in the medical community, but especially for rehab physicians and teams to intervene with these patients. I think there's a lot that we can do. So how are first responders currently assessed? Interestingly, guidelines do exist for the development and implementation of fitness programs. It is out there. The National Firefighters Protection Agency, which interestingly is here in Quincy, Massachusetts, they have written medical and health-related fitness standards. They nickname them 1582 and 1583. And there's a wellness fitness initiative that they've also developed. But only 30% of departments have initiated this across the country. It is not required for departments to initiate this. It's just a suggestion, and not many have, unfortunately. So what is being done now? There are websites out there to direct your patients to where they can gather more information about lifestyle interventions pertaining to their field. I found some of these resources through a recent lecture I went to. This one's a good one, the National Volunteer Fire Council. There's a lot of resources on this website. And here's another one, healthyfirefighter.org. That's a great one too if anybody has any questions. Unfortunately, there's a lot more information out there for firefighters as opposed to police. I think the databases are just more organized for firefighters, not so much for police. So what are we doing? I had the opportunity to speak to someone. His name is Dr. Thomas White. So I went to a recent lecture at the American Medical Athletic Association at the marathon this year, and he's from Gaston County, North Carolina. Sorry, he's the medical director of the Community Health Partners down there, and he's done a lot of research on firefighter and cardiovascular health. He knows Dr. Kales very well, who I've mentioned a couple times. And he and I had the opportunity to chat in person after his lecture, and we've just kept in touch. And this is what his local fire departments are doing. They've initiated a whole lifestyle program for the local fire departments. So they have lifestyle lectures, nutrition workshops. They have an exercise group. They all walk or run together. They even have a Biggest Loser contest, and the chief's son, who I actually have a picture of, I don't know why it's not coming up here, but the chief's son initiated all of it at the fire department. So a key issue is finding a champion in the department who will spearhead this change. I think they're loading slowly. Well, there we go, it's popping up now. That's the fire department's chief's son who initiated the Biggest Loser contest. So what can we do? We can reassess our medical examinations, especially if one of our patients is a first responder. We know now how best to identify those at greatest risk, and we know what to do with the results. So what can you do? This is my call to arms and legs and backs, since we're physiatrists. You can identify your first responders in your practice. Reach out to your local department and ask what they already have in place and what they'd like to get started. You can advocate on their behalf, offer your expertise and support, especially as physiatrists for musculoskeletal, cardiovascular, and psychological health. We can offer a lot. You can teach nutrition classes. Dr. Phillips' fellow, Dr. Ronnie Polak, came in and did a nutrition cooking class with the residents on healthy nutrition, and that was very well received by all of us. And you can assist with exercise initiatives or organize and lead a running group. Dr. Phillips told me about the Walk with a Doctor program, which I had never heard about, but it's local walking groups that are led by a physician to promote health. So there is a lot already being done, but there's a lot more that we can do. There's a lot of room for improvement, I think. So I want to say thank you to my mentors. Dr. Phillips sat and listened to this whole talk and gave me great feedback. Thank you so much. Dr. Stefanos Kales is the gentleman that I mentioned at Harvard School of Public Health. So he has over 600 first responders in his care in his clinic in Somerville, and he told me a third of them are obese. So he's continuing to fight the good fight up there. So in Massachusetts, this is even an issue. And that's Dr. Thomas White from North Carolina, who told me about what they're doing at their fire departments down there. So this project was a really interesting collaboration for me between PM&R, occupational medicine, and public health, something that I don't think I've had enough exposure to, and this was great for me to learn from. And I think we're really lucky to be at Harvard that we can take advantage of all these experts in their fields and collaborate with them. So this was really fun for me. Here are my references. I have quite a few. Like I said, a lot of these studies didn't make it in here just because of time, but if you have any questions or if you'd like to read anything, let me know. Thank you. Yeah, Dr. Glenn. So Dr. Glenn is asking if there's a national overarching governing body to institute these changes, or is it department by department? So unfortunately, from what I've learned, it is department by department. The National Fire Protector Agency, the NFPA in Quincy, like I said, they do have those written standards on fitness and medical care, but they're suggestions only. There's no governing body that has said you must implement this at your department, unfortunately. I think that New York Post article from last year was very interesting. It got a lot of feedback and a lot of people talking about this issue and the fact that maybe there should be more forcefully implemented change, but so far it hasn't happened. Yeah, Dr. Schneider? Thanks. Oh, absolutely. Well, I should say this then. I definitely like to be involved, and I forgot to mention this too. I was going to say, so I'm giving this talk to a union in about 2 weeks. Yeah. Mm. Hmm. Oh, that's interesting. I think that the union, it's the New England Police Benevolence Association. That's where I'm going to give the talk, and what they eventually want to do is have a series of speakers come to provide evidence, to sort of give them the backing to ask for paid time off from work for exercise, which is a controversial topic that they're trying to slowly approach, but they want to get more and more of us in there, I think, to provide the evidence. And some departments do that, but not all. It's certainly not required. So thanks. Hmm. That second piece is an interesting question. To the first piece, where do they get their psychiatric care? So that's very interesting. When I talk to some of these guys, police and fire both, they do have psychiatric, psychological health care at the department. But a lot of the guys won't go because it becomes part of their record. And so they don't want their chief or their partners getting wind of the fact that they're seeing someone in the department for an issue. I think a lot of them, training programs, the academies give preference to military graduates. There's a high percentage coming out of Iraq and Afghanistan that are coming here to apply to be police or fire. So a lot of them are coming back with PTSD, not surprisingly. And the ones that I've spoken to, they say we just grin and bear it. We don't talk to anybody about it because it would influence our acceptance to the academy. So they just don't talk about it. It's really unfortunate. I think some of them do seek outside care, but a lot of the time I think they're just taught to just grin and bear it, you know. Oh. Mm. That's true. I'll find out more. I'll ask them more about that. That's interesting. Thanks. Yeah, Dr. Crandall. Mm. Yep, absolutely. In fact, one study for maybe I should have included it, but for time I didn't. It was actually on SWAT teams, which I never thought, that they'd have any volunteer participants in a SWAT team because it's so specific. But there is one study that looked at career SWAT versus as needed SWAT, they called them, and they are definitely not up to snuff physically compared to the full-time SWAT personnel. So they showed higher rates of musculoskeletal injury, higher cardiovascular complications, and a couple of Dr. Kale's studies I think had volunteer firefighters in there as well. And it's the same thing. They even tend to do worse on all of the standards. Yeah, absolutely. Like one would think, the volunteer ones just aren't in training as often and as to the same standards as the career folks, unfortunately. And a lot of firefighters too. One of the papers talked about the barriers to exercise. A lot of these guys, like Dr. Phillips said the same thing to me yesterday. Some of them have workout equipment in the department, in the fire station, and it's a very sedentary job. So what is the barrier? But a lot of firefighters, apparently I'm learning, they have second jobs. And so I think between the 24-hour on, 24-hour off shifts that they cram into 2 days, and then they go to their second job that can sometimes also be physically demanding. A lot of them are laborers in their second job. They're just exhausted. And if they have a family, when they're in the firehouse, they just want to sleep during those sedentary periods or just hang out with the guys because they're so exhausted. It's interesting. Yeah, Dr. Blacksheffer. Uh-oh. Okay. So I don't know too much about that, no, but some of the papers, so the Dempsey article that I presented on ground reaction forces in police officers wearing equipment or distracted during landing, that's actually out of New Zealand. And the paper talked about how some of their equipment is different than the officers would wear over here. And I would think in terms of unions, it would make a major difference whether you're here in the States or abroad. But to be honest, no, I don't really know much about that. I wish I did. It's an interesting question. Okay, thanks. Thank you, everybody.